Good morning, everyone. My name is Hassan Rasool. I'm a representative from the University of Medical Sciences and Technology, and today I'll be presenting the findings of my thesis titled Clinical Profile, Injury Mechanisms, Neurosurgical Outcomes of Skull Fracture Patients Treated at Muhimbili Orthopedic Institute in Dar es Salaam, Tanzania in 2024. This study was conducted at Muhimbili Orthopedic Institute, which is Tanzania's main trauma referral center. Traumatic brain injury remains one of the leading causes of death and disability worldwide. The burden is especially very severe in Africa, which has the highest road traffic mortality rate, which is 2.5 higher than that of Europe. Despite this, there is a major lack of epidemiological data. There is a major lack of epidemiological data, especially on skull fractures, which limits protocol improvement and prevention strategies. The main objective of my study was to describe the clinical profile, the injury mechanisms, and neurosurgical outcomes of skull fracture patients treated at Muhimbili Orthopedic Institute. This was a retrospective descriptive cross-sectional study that was conducted using consecutive sampling technique. We reviewed medical records of 91 patients with confirmed skull fractures. Data were extracted using Excel data extraction form and analyzed using SPSS with descriptive statistics and chi-square testing for associations. The key variables included the demographics of the patients, the Glasgow Coma Scale score, the vital signs at the time of the presentation, the CT findings, the injury mechanisms, the neurosurgical interventions, the medications used, and the discharge outcome. The ethical approval was obtained from Muhimbili National Hospital. In total, we reviewed and analyzed 91 patients. Male constituted 90.1% of the patients, 60.4% of the patients were young adults, highlighting a predominance of young adults or working age male population. The road traffic accidents were the leading cause or the leading mechanism of injury, accounting for 70.3%, followed by assaults and falls. 76.1% of the patients had mild traumatic brain injury at the time of the presentation. 76.3% of the patients were pre-hypertensive at the time of the presentations. 17.2% of the patients had presented with hypoxic episodes, both of which are important risk factors for secondary brain injuries. 47.3% of the patients underwent neurosurgical interventions, most commonly were craniotomy and craniotomy. The antibiotic prophylaxis was the most described drug with 48.4%, followed by tranexamic acid, anticonvulsants, and analgesics. Overall outcome was favorable, with 87.9% of the patients showed clinical improvement at the time of discharge. A statistically significant association between the female sex and unfavorable outcomes was observed, although this finding must be interpreted cautiously due to the small female sample size. In conclusion, the high favorable rate reflects the tertiary center bias, as patients with mild to moderate injuries are more likely to make it to the specialized care. The male predominance and the high rate of road traffic accidents mirrors the sub-Saharan African patterns, emphasizing a preventable public health crisis affecting young adults. Moving forward, we recommend implementing a structured 6 to 12 month follow-up protocol, expanding national trauma registries, and prioritizing road safety, injury prevention strategies. Finally, I sincerely thank University of Medical Sciences and Technology for providing the environment needed for this research. I would also acknowledge Mohibile National Hospital for granting permission to conduct this study, and thank you for your attention.
Thank you very